Hello, this tutorial is about a dermatology study resource called Uderm. It's designed to increase efficiency and memory by learning in a spatial way. As we know, dermatology is a broad field, many diagnoses, and is learned best in a visual manner. And this resource utilizes the commercially available Simple mind mapping software, Simple Mind Pro, in an effort to accomplish more of a visual learning platform. Essentially, it's comprised of 10 distinct mind maps, as you can see over here on the left, 9 of which are families of dermatologic disorders that are color-coded to help with remembering them. And then this one here is the home one, which houses a lot of the resources that are not available in the mind maps themselves. You can see here that MedDerm is comprised of those 9 things that are listed over here. There's links on each one of this to take you to the mind map, or you can just select the mind map from over here in the left corner. Not discussed within these mind maps are basic science, pharmacology, and surgery. If you'd like to learn these more, you can read them simply in the Alicon Hocker Review book a week or two before the test. For additional learning, I've included all of the Q banks for the basic science sections of Bologna in here, pharmacology, resources for dermoscopy on here. Derm path that is not discussed within the MedDerm because I've combined it is available here. And then Q banks for derm surgery, along with access to the ASDS Surgical Primer Q bank and the surgical case log sign-in, and then the cosmetic Q bank here. Other resources are on this side, which include links to Visual DX, Litch Drug Eruption Database, up to date, the Mayo Derm server, which you have to be on the intranet for that, and a couple other things here. The Kodachromes are going to be super helpful. There's probably about 60 of them or more, and you don't have to be on the intranet to access them. You can just click on them, they'll pull up, and you can easily go through them at your leisure wherever you are and learn on the go. The other QBank section here has good links to Derm in Review, which is a free QBank, and then the AAD Board Prep Plus login, which probably should use closer to the time when you're going to take boards, because it's kind of expensive, about $300 for a 6-month subscription, but has about 900 to 1,000 high quality questions. And then this is the Bologna Miscellaneous QBank, which basically is all the stuff that didn't fit into the mind maps, which I'll tell you about in a minute. And then the Galderma QBank links are here if you're running out of resources and need something else to do. So getting back to the mind maps, basically they house all the salient information from Elston Derm Path book and Alicon Hocker Review book, and I attempted to combine MedDerm, PageDerm, and Derm Path all within these mind maps, as opposed to what many educational resources do. They separate those 3, and so I've tried to combine them so that it makes learning the material more efficient and hopefully more memorable. And in addition to that, I've also included about 30 more diagnoses that aren't in any of the review books that we have, and several hundred more high-yield photos, as well as links to Bologna and Elston QBank PowerPoints embedded within each of the topics. So it's really everything you need to know to understand the breadth of dermatology and to do well on your exams. I'm going to just go ahead and show you how it works here. This is the home page. I already went over that with you. If you want, you can click on a link here and it'll take you to the mind maps, or you could just click on the side. So let's just start here with inflammatory. This is the red family. And you can see that this whole family over here, let me get rid of this on the side, this whole family over here is acneiform. This is all urticaria, angioedema. All this is inflammatory, which basically includes eczematous. I'll zoom in a little bit here. This is all the eczematous stuff, such as atopic derm, contact derm, separated into irritant and allergic. And then you've got papulosquamous, which includes psoriasis and and PRP and several other things here. And then all this is lichenoid, or excuse me, interface, which includes vacuolar and lichenoid. And you can see that LP has its own little circle here. And then it's got neutrophilic dermatoses, eosinophilic dermatoses, figured erythemas, and a couple miscellaneous things. And if we go over to the acneiform section, we can see that we've got acne variants over here, all along the left. We've got transient acneiform eruptions of infancy. This kind of demonstrates how I've attempted to combine some of the peds derm into the more morphologically sensible categories, as opposed to keeping it totally separate. And if you want to learn about it, you can click on this. All the transient acneiform eruptions of infancy, you can just do the Bologna QBank on that if you want, right there. And it'll take you right to it, and it'll pop up, and you can go through this. If you want to learn about, say, ETOX, you can click on that, read. There's not a whole lot to say about it, so it's a fairly simple thing there. You can click on the photo and make it bigger if you want to look at it. If we go out, all the acneiform syndromes are here, rosacea variants here. If you want to look at LMDF, you can read about it there. Click on the photo to see the clinical features more, and then the corresponding derm path is right there that you can look at. So this is a good example of what's going on in the red family. If we go over to the mind maps, we can click on this family, which is the yellow one, has secondary dermatoses, photodermatoses, and drug eruptions and ulcers. It does a nice job of separating all the neuroderm and psychoderm over here, all the other physical dermatoses here. Like you can see, it breaks it down into temperature-related, mechanical, newborn injuries, and radiation dermatitis. Again, combining peds derm and med derm, since it made more sense to do it like that. And then down here, photodermatoses again demonstrates the combination of the two, with the genodermatoses with photosensitivity, since that's the primary feature of those, photoaging, and then you've got like porphyrias in a miscellaneous category over here. All of drug reactions are here. You can see it's separated into sick patients, non-sick patients, pigmentary change, and then photosensitivity and chemo reactions. And so if you want to learn more about that, you can, click on the tab. Information will pop up on the left, and if there's a corresponding QBank to go with it, you can click right on it. So we'll go to the next section here. This is the hair, nails, and mucosal disorders. All the nail disorders are up here. All the hair disorders are here. All the mouth disorders are here. And then this is all of the syndromes of the congenital syndromes of the hair nails. So if we were to look closer at the hair disorders, you can see all the non-scarring processes here, all the scarring processes here, all the hirsutism and excess hair here, and then all the hair shaft abnormalities here. Over here, we've got all of the ichthyoses, and then over here we have all the PPKs, inherited and acquired. So if we wanted to look at it a little closer, we could go in here. You could do the QBank on PPK if you wanted. Circumscribed palmoplantar hypokeratosis, you would click on that to read more about it. If you want to see the clinical, you can click on that. If you want to see the derm path, click on that. Let's go to the next family here. This is the orange family. Again, these aren't perfect families, but they make the most sense that I could gather, and hopefully the color coordination will help you be able to remember these. And as you learn them and study them, it will become easy to remember where a diagnosis is based on the color and the location in which you've learned it. So for vascular, I've combined all of vasculitis here. You've got this cutaneous small vessel, you've got the medium, small to medium, you got the medium here, and then the large here. If you were to go in closer, you could see that the cutaneous small vessel vasculitis has several different types. You can click on this and read about it, increase the size of the picture and look at that. Granuloma faciale, Click on that, as well as the corresponding H&E. So if we go back out, and then I've even included a nice algorithm here by Dr. Wetter. Vasculopathies are here. All of the congenital vascular disorders are here, not the neoplastic ones, just the vascular malformations, and then stuff like CMTC, HHT, ataxial telangiectasia, and such like that. And then over here are the other vascular disorders such as pigmented purpuric dermatoses, telangiectasias, etc. And then over here, all the paniculitides. Pretty much got everything you need to know with the corresponding path and clinical if there is anything distinct. Lipodystrophies, congenital and acquired there. Let's go over to the section on blistering and connective tissue diseases, the purple family. So over here, all the inherited blistering, such as epidermolysis bullosa here, Haley, and Darier's. All the other kind of miscellaneous blistering here, like bullous diabeticorum, blister, etc. And then over here, you have all the autoimmune blistering diseases. Pemphigus family and the subepidermal family. You can see the bullous pemphigoid is here, and all of its variants are listed below. You can see the clinical variations and if there's anything special based on DIF. Down here is the connective tissue disease. There's helpful information on all the high-yield labs here. You can test yourself on all those labs there if you'd like. And then if you zoom out just a little bit, you get a more bird's eye view. All of this is lupus and the varying types. You've got chronic cutaneous, you've got subacute, and you've got acute over here, and then bullous up here. This is all dermatomyositis. We can zoom in and look. You can see it's broken down into juvenile and adult and all the various subcategories of that with the associating derm path and the high-yield clinical photos. All here is the miscellaneous connective tissue diseases like relapsing polychondritis, etc. And then all down here is the sclerosing dermopathies such as systemic sclerosis, morphea, mucinoses, etc. All right, we'll go over to the pigmentary and nutritional metabolic family, the kind of gray color family. So if we go a little bit into pigmentary disorders, all of this is acquired pigmentary disorders. This is hypo, and this is hyper. And then all of this over here are the inherited pigmentary disorders, and this is a pigmentary mosaicism. And then if we zoom into nutritional a little bit, we can see that all the vitamin deficiency and excess is here, and all the miscellaneous metabolic disorders are over here. A fair bit of genoderm stuff is in there. Click on this and you can see that. Let's go to the next one. This is the granulomatous histiocytic family, along with depositional and dermal abnormalities. So if we go in to this, you could quiz yourself on derm path for granulomatous diseases. Non-infectious granulomas here, of course, sarcoid, GA, and all the other ones over there. And then the histiocytoses, like LCH is here, and then non-LCH histiocytoses here. For the abnormalities of dermal and elastic tissue, I've separated into acquired and inherited disorders. And you can see if you were to go in here, you got several things you could test yourself on. You can see there's a lot of different diseases within this category. You got perforating diseases here, and then all the inherited stuff here, which houses a number of genoderms. And then if we go right over here to depositional, you can see that you got amyloid calcification disorders, xanthomas, and other. All right, almost done. Neoplastic section. This is the largest section. The entire mind map, if you were to take all of it, it's about 1.3 gigs, and neoplastic alone is almost 500 gigs. So, or excuse me, not 500 gigs, 500 megabytes. So it's large, but it really helps because let me get rid of these so you can get a sense of the size. It helps because a lot of these disorders can be confusing, especially adnexal stuff, because it's stuff we don't see very often, and a lot of the names are pretty long and difficult to spell. So here's all of adnexal neoplasms, all this stuff over here. Here you've got sebaceous, sweat gland, and over here is the hair follicle neoplasms. So if you go into here, hair follicle neoplasms differentiated by differentiation type. So folliculosebaceous, germinative, matrix, and you can see that all these have a nice categorization to help you remember them. And then all the sweat gland neoplasms, of course, which are challenging to remember, but separated nicely here for you to learn. And then up here for sebaceous. And if I click Command 2, my sidebar comes up and I can click on any of these to learn about them, like sebaceous carcinoma. Click on it here, get a good clinical photo of what that looks like. I could also click on the derm path to get a good sense of what that looks like under the microscope. All of melanocytic neoplasms are here. You could quiz yourself on that topic. You can see how it's all broken down into the various types. If we go down here to melanoma, you can see there's even a link to a helpful up-to-date handout that gives you an idea of risk factors for melanoma and what kind of risk your patients are at in terms of increased risk or decreased risk depending on various factors. And then you can read about everything really that you need to know about melanoma there. You can click on the clinical photos, etc. I don't want to belabor this too much, but you can see that it's all broken down into its various components. I'll zoom out and go over that with you. All of this is melanocytic. All of this is vascular up here. All of this is fibrohistiocytic. All neural is here. This is all of the soft tissue stuff like adipose, cartilage, muscle. In fact, this is all the adipocyte neoplasms. This is all the muscle neoplasms, and this is the soft tissue neoplasms, which are uncommonly seen in dermatology, but still there. These are all the hematolymphoid neoplasms, such as MF and other T-cell lymphomas, B-cell lymphomas, and I've included mastocytosis here because it's technically kind of a hematolymphoid type process, but didn't have a great place to put it otherwise. All of cysts are here. All of metastatic tumors are here. These are all the keratinocyte neoplasms. If we zoom in, you can see all these are broken into benign and malignant. You see that you got basal cell, all of squamous cell here, and over here on the benign section, you got all the types of SKs and their varying types of histologic presentations, and then all the other types of keratoses, porokeratoses, etc. So it's got all neoplasms are there, and it's helpful in a way that you won't have to get them confused anymore. The last section, infectious, also a big section. All of bacterials here. You have gram positive, gram negative. Up here you've got the mycobacterial infections here. And then over here you've got all the spirochetes. If I zoom out just a touch, you've got all the fungal disorders here, all the viral here, and down here. And then these are more of the parasites and other creatures that don't have a good home elsewhere. So that is it. There's certainly more details as you go and learn it, but I hope that you will find this useful. If you do want to use it, all you have to do is click on the link that I sent in the email. You click on this to download the full edition, which I recommend. You could get the app for your iPad or iPhone. However, due to the size of these mind maps, there is some functionality issues. It would work, but it's just a little slower and a little more cumbersome. And the Mac or Windows desktop versions are probably better. If you want to do it, I do recommend getting the full version. The free version you can use, but it has limited functionality. The full version is 25 euros, which comes to be about, I think, $30. It's a one-time fee, and once you download it here, make sure to open it, as I have mine open here, and then go to the next step on the list of things I recommended in this document that I sent you. Click on this link. It'll take you right to the shared folders on my Google Drive, and I want you to download. Just select all of these at once, and then just say download, and it will download everything. Again, it's 1.3 gigs, so it will take probably about 5 minutes to download. It'll download it to a zip, as you see here. Click on the zip. It'll open it up, and then you can see that within this are the 10 mind maps that you need. Now go to the software that you just downloaded from Simple Mind. So this is what it would look like. You go to Mind Map up here, import, and then all you have to do is go to the mind maps that you just downloaded and select each one, and you'll have to open them, and each one you'll have to do individually. You can't just do them all at the same time, so that will take a few minutes of work. But once you have them all there, you'll have them all downloaded on the side here, and then if you want, you can connect them to Dropbox. You just say connect here, and it'll ask you for your Dropbox or Google Drive credentials, and then you can back up all of those mind maps if you want, and you could copy them to, by selecting on them, you could copy them to here it would say copy to Google Drive if you want, and then you could access it on your phone. Now if you don't want to get the desktop version at all, you want to just get the phone, there's a similar process to do so by just getting the phone app. But again, due to the size of the mind maps, there is some delay, and I think it's not as functionally appealing. So that's it. I hope this tutorial was helpful, and if you have any questions, you can email me at uderminfo@gmail.com, or if you have questions or concerns regarding the Simple Mind software, you can use these emails, which are also on the home page right here. Thank you.